Hello everyone, my name's Nathan from Active Health Clinic, and today I wanted to really reach out and talk about the COVID vaccine and invisible illnesses. So this means fatigue syndromes, pain syndromes, orthostatic intolerance, POTS, sleep disorders, and most importantly today, mast cell activation syndromes, or MCAS as we currently know, because there is a bit of an impact with the different vaccines and which one you should take. Now, with all this, I really want to make sure that this is advice, and I want you to make sure that you can take this to your GPs and speak to it to a professional about it, because we've seen a lot of opinions, a lot of people doing their research. And it's really important that we look back at the government websites as well as our trusted doctors. So whether that be our GPs, immunologists, but I think it's really important that we have a conversation. So today is not really designed to tell a person what to do or to say it's good or it's bad. For the record, I am double vaccinated and I am for vaccination, but I also respect people's opinions. And I think it's really important at the moment what is right for one person may not necessarily be right for another. So there are what we know are the standard side effects that can come with some vaccines. So currently, as of today, which is the 17th of September 2021, in Australia, we're using two vaccines, so AstraZeneca or AZ and the Pfizer vaccine. Now, in the coming months, we're going to be looking at having Moderna, and then we're also looking at Novavax as well. Now, at the moment, we know more about the AZ and Pfizer vaccines and some of the side effects that can come from these. So we know with AZ that there is a chance of blood clotting. Now, these are very, very small, and in fact, you're more likely to get struck by lightning or be in an accident and die on the way to actually having the vaccine than to be getting those the blood clots. Now, similar with Pfizer, pericarditis is more probable with this, but again, very, very low, and those same things are more likely to happen. Now, for pericarditis, it's mainly in males age below 40, and for the blood clots, it's more prevalent in females below 40. Now, these risk factors are very low, and I really want to keep saying that again and again. And their risk factors are actually much lower than if you get COVID, and you're much more likely to have blood clots, you're much more likely to have pericarditis than the vaccine itself. But if you do have concerns about these, then speak to your medical team and your GP. And if you're having the vaccine, then speak to the people that are vaccinating you, because they're going to be able to tell you exactly what symptoms that would be and therefore what you'll need to do. Now, make sure that if you feel that you're getting these symptoms, or simply if you're not sure if you have been vaccinated, then to ring a hotline. There are plenty out there. And then also maybe go see your GP, or at worst or at best, pitch up to accident and emergency. And it's really a lot like when someone presents to accident and emergency with chest pain and it doesn't turn out to be a heart attack, then that's actually a good result, because both the clotting and the pericarditis are actually very easily managed with medication, and there's no long-term problems. If we push through or ignore those symptoms, then that's when we can run into sometimes some other problems as well. Now, you all have symptoms of maybe pain, fatigue, hypersomnia, dizziness. These symptoms will be a little bit different, and again, hence talking with your doctors or vaccinators as to what this may be. Now, I really want to talk a little bit about now invisible illnesses in these vaccines. So with the exception of MCAS, which I will get to in a moment, there is no evidence that it will worsen a person's condition. And even within long COVID, which is people that have had COVID and have developed fatigue syndrome or POTS or orthostatic intolerance, or even respiratory or breathing difficulties, sometimes it actually helps with those people, but most often it's a neutral thing. So there is no extra risk factor for a person if they even get COVID with standard fatigue, pain, etc. But there are for things like high blood pressure, asthma, and others, which I won't go into today. Now, when people do get the vaccine, it's quite common to have some minor side effects afterwards. Now, that could be an increase in your symptoms, so it might be more pain or fatigue. It could be chills, even a fever, sweating. So if you do get these, I often say to people, this is something that you've earned. So you've earned through having the vaccination. Likewise, if you had to attend a wedding or something along those lines, and that you had a setback afterwards, that's something you've earned. And if we manage it in the right way, you'll recover from that setback and be able to take those next steps. Now, with the normal setback that we have with fatigue, pain, then we see this up and then this sort of gradual decline in symptoms. Now, what we're seeing with the vaccines is that we have this up and sort of hold, but then it just disappears and it's like gone. And that usually lasts, for some people, they're not getting any at all. Some people for 2 to 3 days, some people for 4 to 5 days. So that's what we're generally seeing in the population. And I know that within the AHC connection and the community on the Facebook page that we've seen that experience has been conveyed a few times. Now, this is where I want to come to MCAS, or mast cell activation syndromes, and the Pfizer vaccine specifically. So what is MCAS? So MCAS is basically where our mast cells react to a lot of different chemicals or environmental factors. And that's being in a very simplistic way. They release histamine, and then that can cause a lot of problems, which can come from food and other things. But in regards to tachycardia, dizziness, and realistically, it's a lot more complicated. And we have other videos that talk about MCAS, what it is. So Luke and Jackie have a long discussion in regards to that and the management of that. Now, with the Pfizer vaccine, and if any of you have had the Pfizer vaccine like me, you'll look at the actual sheet and it will say, if you have MCAS, then please let us know. Now, there is the side effects from this, and from talking with an immunologist in the past week, that they haven't seen any cases of anaphylaxis, even though that has happened or been very rare cases. But they have seen some people that have MCAS have ongoing symptoms for up to 4 to 6 weeks afterwards. And I know that I've followed up a few people that have had that as well. So if you have an MCAS diagnosis or a concern about this, then it's really important to speak to your doctors, drop us a line, and just to see whether that may be you. Now, having hay fever, having allergy to say nut or something like that is not MCAS. MCAS is a very different thing, and it's actually quite a rarer condition too. So we see a lot of people with fatigue, pain, orthostatic intolerance, POTS, but very few will actually have an MCAS diagnosis. But if you're unsure, again, speak to your doctors or immunologists. Now, if you have MCAS, then you need to be careful with the Pfizer vaccine. And before getting that, we would really recommend you speak to someone. However, saying this, that the other vaccines do not have this reaction. So AZ does not. Moderna, even though it's the same mRNA technology, is different. It's a slightly different spike protein. And then the Novavax, which is actually a protein-based vaccination, which is based off the flu vaccine, does not have that either. However, that's not here yet. But generally, if people have reacted well to the flu vaccine, then they're most likely going to react quite well to the Novavax vaccine as well. So there have been millions and millions, probably even nearly close to 1 billion doses of the vaccine delivered with minimal significant side effects, and especially those that outweigh what the effects of COVID can be. And even if we think about in context that older adults or people over 80, because the mortality rate is so high, that even if there was a significant event in 1 in 10 people, they would still recommend the COVID vaccine. So it's important to understand our bodies and where we're at, and that you make your own decision. One thing that I'm not really enjoying in society at the moment is that I'm vaccinated and you're not. That makes me good or that makes you bad. This is something we need to respect in each individual. And it's really important that we provide the evidence, the supporting data that comes with this, and help people make their own decision. But if they make that own decision, then we need to respect that decision and have open conversation. So to that point, I'm always open to questions. I will try to get back to as many people as possible if you'd like to post some below. However, I'm sure I won't be able to ask or answer every question. So raise this with your health professionals. Raise it with a few health professionals. We don't always trust a plumber on the first quote. We get a second quote. It might work out that it's about the same and it sounds right. But there's no such thing as a dumb question. So we're always happy to chat. And if you found this helpful, please tag, share, and what you can. But hopefully that's cleared the air a little bit. So thank you for listening, and I'm sure we'll hear from you and speak soon.